Okay, good evening, everyone. I think in the next 15 minutes, I'll basically tell what we do for a living, right? All that is actually shown over here is we have done this, so you'll be able to see the impact measurement, how we measure impact, how you're basically doing things from a health technology aspect. Just a quick introduction about NH. We have one of the largest healthcare providers in India, have close to around 6,000 plus operational beds. Just to show about the velocity of operations, we do around 300 plus surgeries and procedures a day, much higher. 19,000 employees spread across the world. We also have an international hospital in Cayman Islands. So as we all know, the shifts that are actually happening in healthcare, right? The 4 key shifts that are actually happening, especially after COVID, is the shift from illness to wellness and the shift to outcome-focused care. The second shift that what we basically see is at every hospital, the cost of healthcare operations has really gone up. So, from an operational perspective, we have to optimize costs, at the same time deliver superior care. Third is, we all know the disparate ratios from a nursing standpoint. We have 1 nurse for every 400 plus patients. We have 64 doctors for 1 lakh citizens. We have, so the ratios are itself skewed. So how do we basically bridge the last mile healthcare, right? How do we basically make this happen? So the use of how do we, so we see a new trend on shared services, which will help us deliver things faster, smarter, quicker with the aid of technology. And with all these digital systems that we have actually invested in, right? Business wants to understand. Okay, somebody's putting on music. Thank you so much. Okay, so I think maybe it's music to their ears, yeah. So I think in decision making, right, business wants to understand how they can basically make decisions faster, right? Not only and also in the clinical space also, right? When we talk of data, predictive analytics, image analytics, there's been some tremendous amount of activity that is actually happening, and business wants to harness that data and put that to good use. So the journey that we actually started. So our chairman believes in providing quality care at affordable prices for a broader population in India. And he always believes that technology is the force multiplier in which basically takes healthcare to the last mile. And if we have to really do this, which means that we have to really invest in technology. And our investments in digital started way back in 2015. Because as we all know, digital is, is a journey that we actually take. It's not a one-off. You have a starting and an end point, or you don't have a destination. Along the entire journey, you make several stops. You basically understand or learn what things have gone wrong or what things have gone right, recalibrate yourself and move forward, right? So our journey started in 2015 and 2016, where we said that the first thing that we have to do is lay the foundational platform for the future. The foundational platform which will help us to scale at will help us to drive down the cost of operations, will help us to provide superior technology, superior patient engagement. So the platform is very important because that becomes your rock bed. And then we said that as how a heart and a brain is very important to human, we created what is called as Atma and Meda. Atma is the soul of the organization. This is the health information platform, and Meda is the analytics, advanced analytics and artificial intelligence system. And we strengthened our technology operations. We rolled out Meda with whatever data that we actually had. So this is one of the key learnings that we had. We never really built everything and rolled out on day one, but we built several incremental things to be and basically delivered, right? And digital is all about it. It's not building some big bang stuff and then rolling out. It is about several small initiatives creating a substantial impact on the business operations. So as we progressed in 2017 to 2019, that was one of the crucial periods. We said that we have tremendous amount of domain expertise. How do we basically harness this domain expertise? We said that why can't we be one of the world's largest health tech player? And that is when we started the Software Development Center with Atma and Meda products. And we basically built out this platform in 2.5 years. We not only built this platform, in 2019 September, we started rolling out the platform, and we completed the rollout across all 47 healthcare facilities in just 10 months. Even when COVID was there, we were just able to roll out these platforms virtually. And this speaks volumes about how a user-centric design approach that we actually took to building out the platform. Today, when we see many of these softwares that have actually designed don't take the end user in mind. Who is the end user? The warehouse person who's actually sitting, the pharmacist who's actually sitting and dispensing medicines. So we as technology people cannot sit on a throne and basically build systems, but we have to be with the people, empathize with them, understand their behavior, understand what they are actually going through, and build systems accordingly. And that is one of the primary reasons why we were able to roll out our systems in 10 months, right? And 2020 or 2021 was all about going live across multiple hospitals, rolling out the lab information systems. I'll show you some of the impact metrics that are actually there. 2022 onwards, our strategy from a digital standpoint is changing experience. So we have launched a digital transformation office because digital is going to be the force multiplier, right? It's going to help us deliver technology faster, better, smarter, help us deliver superior patient experience. So we have launched a slew of initiatives to basically improve the entire digital presence across the entire landscape, because we know that it is indispensable. So this is how we are actually laid out. So in any IT project, you have strategy, structure, people, process, technology. Our people are our assets. When we created all this in 2015, we laid the foundation. We have a clear view of how enterprise IT basically need to look, right? We invested. We invested in functions. We have invested in world-class engineers to basically build and roll out systems, right? And this has been built over a period of time, and it's just that done in 6 months or 7 months. It's taken 5 to 6 years to even build out this team. So some of the key advantages that we have: strong domain expertise, we have execution capabilities, fantastic execution capabilities, very clear understanding of how to roll out products, how to hit the sweet spot, how to basically create that impact, which I'll show you further. Partner ecosystem, build fast, deliver in an incremental approach, which is the agile methodology, co-creating with the users. That is very important. It is not just a software development center basically builds and roll out products, but then sit with your users, co-create products that are actually there, which will turn out to be impactful. And then use that for delivering extensive insights on how business should perform and what really matters to stakeholders. So this is our landscape. As it looks today, this is how simple a healthcare provider landscape can actually look like. Completely simplified, I could say. So what are some of the things that we basically did? See, from a technology focused, we basically had a change in mindset. We said that digital is inevitable. We need to ensure that we develop that culture. We have ensured that we transform that culture at every level in the hospital, starting from a ward nurse all the way to the CEO's office or the chairman's office. Rather than considering digital as a function of IT, we said that we have to build a digital ecosystem. Digital is not an IT initiative. Digital is a business initiative. We made sure that that basically permeated into every layer of the organization. Moving from inertia to innovation, we all know, and we always firmly believe that if we don't innovate ourselves, in next 5 years, we'll be one of the healthcare providers. But we will not be the healthcare provider who is providing quality care at affordable prices for a broader population in the world, right? If I have to be in that position, then I need to have an innovation mindset. And gone are the days that we have actually worked on silos. Today, it is a very highly collaborative environment, and we always know that united we stand, divided we fall. Only when we collaborate, we can actually succeed in this digital ecosystem. So what this basically really means, right? When you talk about initiative, what it basically leads to and benefits, right? Even if you do a small Aadhaar-based integration at your, at the registration, what does that basically do? It basically leads to accurate data capture, which in turn helps efficient operation. It improves patient experience, right? And a whole lot of benefits. Like this, we have mapped out each and every initiative across various aspects, across hospital operations, across integrated care, across the healthcare operating platform, so that everything is measurable at various stages. So some of the impact metrics. Today, out of the total appointments that we actually handle, 25% of the appointments are online appointments. And in that 25%, NH Care, which is our the digital platform handles 80% of that is actually handled through self-service mode. We have actually flipped the charts. If you see if you see the entire chart from 2019, the contact center used to handle the AMS is basically the contact center. We have completely flipped that entire thing and ensured that people are able to book at ease from a self-service standpoint, and we are able to drive this. The graph on your left-hand side, which basically shows the biggest community that we actually handle is our patients. We have around 250,000 patients logging onto our platform, 250,000. We have around 593K patients who have already registered in our platform, 250,000 monthly active users. That is the load. Health records, book pay online for services, IP invoices, OP invoices, pharmacy bill, vaccination tracker, health records. Everything is available at the click of a button. We have made that. We have ensured that it is responsive, it is simple, and it is usable for people. So here we demonstrated that barriers can be broken. Okay? Today, our biggest size, it's demonstrated by the fact that patients are our biggest community of users. We have basically flipped the entire thing from a contact center into a complete self-service, and we are marching on to much more higher levels of adoption. We brought something for the doctors. We brought a WhatsApp for doctors. It is called as Atma app for doctor insights. It's called as Adi, which is the origin, because the clinical care starts from the doctor, right? We ensured that the doctor is able to see their lab reports, radiology reports. They are able to communicate to their patients, discharge summary, progress notes, orders, medications. This is an app that they love. There are around 4,500 doctors, 4,500 healthcare workers, including all the doctors in the organization, basically connected to Adi. And right from the point at which the patient gets into the IP ward, moves to the OT, to the ICU, and back to the ward, the entire journey is basically traced, tracked, recorded, completely with device integration. Today, these are the numbers that you actually see. This is the impact that we actually have created. And this has basically brought back the joy of care, so that today, a doctor can wake up at 5 a.m., do his ICU rounds on the mobile phone, and when he walks into the hospital, he's very confident, or he has a very clear line of sight of which patients he needs to address first. And this entire product was, the chief product architect was Dr. Shetty. The entire thought process, the way in which we consume, this is the WhatsApp for doctors. We have weaned away all our doctors from WhatsApp. And this is the true change that we have created. Let me show you one more thing. Force multiplier. I told you about how technology can be used as a force multiplier. Today, we print around 50, 60 crores worth of, we print a lot of papers. We, in hospital, sir would know, we all love papers. We are trying to eliminate papers. Today, all the OP invoices, IP invoices, pharmacy bills, everything is in our app. Today, we are seeing a heavy load on the app because we don't give printouts. We save the environment, the sustainability aspect is there, right? We are able to optimize cost of operations, right? And we are able to simplify things, superior patient experience. Patients don't have to wait in queue. Scan the QR code, pay for services. Once your thing is paid, go and show it to the counter. They scan your QR code, and it basically gets done, right? We basically built lab information services, lab information systems. We saw a 36% TAT drop in top 5 sites. It's purely because the superior design approach that we actually adopted, the integration methodology, the architecture, all facilitated 30, which means that my lab can handle even more workloads today, right? This is across the group. These are numbers which are there in our BI system. These are all recorded data that is actually there, right? And we are working to reduce paper and all that stuff. So I talked about Atma, the platform. Let me talk to you about Meda, the intelligence, right? And Meda basically picks over where Atma basically hands off. It handles the data from a slew of systems and then processes it, right? So what Meda does is it focuses on every inefficiency that is actually there in the system, every leakage that we actually have, every opportunity that we have missed or we need to track, every root cause that, for a given problem and every exception that we have made for several use cases. It identifies everything and helps us basically give relevant business and clinical insight at the touch of a button. Today, everything is available. So just let me show you, these are the number of use cases that we have actually done. We have cracked every bit, every part of a department. There are some clinical areas which I have not shown, but we have already written a couple of papers. We have published it in peer journals, in well-known scientific journals. But this is what we have actually done, right? The proof of the pudding is today, business reviews happens using BI. Gone are the days where we are using, we don't use spreadsheets, we don't use PowerPoints, except for presentations like for closed group like these, but it is completely on BI. Right? And this is how we have actually transformed the entire landscape. Right? We walk the talk. We said that we will invest in technology, and that is purely because we strongly believe that how technology can be harnessed. And what we are actually into, we know that analytics, has to reach every level. It is not only for the elite, or it's not only for the management alone. It's not only for a set of managers. So democratization of analytics across the organization, which means that at every level, so we are rolling out our nursing app called Nama, right? It's all a lot of Sanskrit names. So Adi is for doctors, Nama is for nurses, because we prostrate them because they are the ones who are doing taking the brunt of the workload that is actually there. And then we have Aham, which is Atma Hospital Administration on mobile. So, but then when you talk about democratization, institutionalization, right? So we are democratizing analytics, and we are ensuring that we have told that digital is not a choice. It has to get into your cell, into each and every layer of your body, which means that analytics-based decision-making is also not a choice, but the process, right? We have done this, and we are on our way to refine this further. And what we have learned from all this, right? One is to always have an innovation mindset, because if we lose that, and in this digital ecosystem, we can easily be eliminated. We have seen the companies which are there in 1990 doesn't even exist anymore, right? It has been replaced by internet age companies. And as a healthcare provider, we have firmly understood that we need to innovate. Only when we innovate, we will succeed, right? And to this, we have created the Digital Transformation Office. We have created various, working groups to see how we can basically bring out all these ideas and basically operationalize it. Feedback channels. One of the key elements of building any world-class product is to be receptive to the customer that you actually serve, whether he's internal or external, which means that I close the loop by ensuring that there is a feedback that is there so that everybody will be able to ventilate and I understand what they are saying and close that gap. So having open channels of feedback, which means sharing everything. Participating. Whenever new systems basically come in, it has a change management issue. It basically, people have to unlearn to learn, right? So can we make it easy for them, right? Then that is where the user-centric design approach basically comes. How would you make this much more easier so that more people are able to participate? The more the merrier, more people are able to do this, and then it helps us to spread the adoption. Last, always have a continuous improvement mindset, because if you think that we have reached the end, that then we will be overconfident and we can easily get eliminated. But then having a continuous improvement mindset always enables you to push boundaries and understand how things can be done even better. There is always there is no end to this, and there is no end to anything from a technology aspect. And I would complete by saying that this is what we do for a living, and this is what I've done for the past 8 years, having joined NH. Thank you so much for the opportunity provided. I really appreciate it. Thank you.